First, I'll look at the evolutionary psychology view. Are we predisposed?
Oh, that's a good question, Carlos. That's like one that hit me between the eyes. This is, people will tell you, and it's really an interesting one. It's almost like what you guys have in the States, me being a Canadian, I can say this, I teach in the States and work in the States as well. You have the Republicans and the Democrats. You're either all for Democrats or all for Republicans. You know, there's no Whig party, so to speak. So when you're looking at addictions this way, most people, interestingly enough, that are more prone to having addictions or they have the addiction, more of them are inclined to believe, assert, or even buy into the premise that it's a biological cause. It's physiologically innate within them, that there's some sort of gene that makes them more prone to it. Then if you take the flip side of it, the other side of the other believers, they'll say, no, it's choice. You had a free will to go and try this, whatever it is, your substance, and you got hooked on it. And then there's those that'll say, like myself, I believe in an eclectic approach, eclecticism, which says it's biopsychosocial spiritual, meaning there's a biological cause. You probably potentially do have maybe a physical predisposition towards it, but once you've used it, you've altered your brain chemistry, you've altered your hormones, which now you enjoy taking it or using it. You have a psychological possible defect, could be cognitive distortions, cognitive dysfunctions, that, where you feel that you need to take something or do something to either, provide you amusement, pleasure, or overcompensate some sort of psychological pain, whether it be some sort of depression that's non-clinical. Then there's the social phenomenon that some people become addicted to something because of the social environments. A big one is this gambling. And there's a really big concern in this, where we've had concerns about schools, high schools, that have after school poker clubs, because the concern here is this going to be the next wave of potential gambling addicts? But yet they're getting together and they're socializing, and socializing is creating a conditioned response, which could potentially lead to the addiction. And then, as I said, there's the spiritual component, which we've talked about it. The spirit itself, it does something for your spirit. There's something within you, and it could have even been religiosity, some sort of belief system where you were brought up in a very rigid environment. There could have been psychological or religious abuse done to the person. And this has happened in many cults, different types of cults where there's been abuse. And one way that the members do cope with it at the end of the day, or in religious fundamental homes, is they drink or they drug to hide their shame, feelings of guilt, or to overcome the abuse that's happened to them. So I like to take that approach, Carlos, where it's biopsychosocial spiritual. And I think when you look at addiction that way, it's better, because I believe in differential diagnosis. You don't treat two people the same way, when I'm saying treating the same way, when you're looking at how they're going to go about overcoming their addiction, especially if they have a dual disorder or a concurrent disorder, which means they have a mental health problem plus an addiction. And then don't even get me started on the whole other stuff, because if you're saying it's strictly biological, then how do you explain pornography? Because pornography, gambling, there's not a gene in us for pornography, because it never existed per se until the media brought it to life. However, some people, and I talked about this in a book I wrote with Dr. Deborah Leno, who's a sex therapist in New York. We wrote a book called The Madonna Complex, and these are men that are addicted to pornography, that ironically some people back in the ancient times would look at art, famous arts where there's nude art. That was their porn, some people would assert. So at the end of the day, it's your perception, why you're using something, what is it doing to you, and most importantly, can you stop doing it on your own? Because if you can't stop and it's interfering with your work, your family life, your social life, and it becomes extremely stressing if you're not engaging in that act, then you know you have an addiction.